Welcome back to the Wellbeing in Practice podcast, bringing you the latest in complementary, integrative, and functional medicine conversations. I'm Tanya Borofsky, Head of Education here at Amrita, and your host. And today I have with me the infamous naturopathic doctor and so much more, Kristi Morlan-Hughes, who will be known to many of you who've been in the industry. I can't even quite say this, for sort of over 2 decades, and she has dedicated her professional path to the study and practice of natural medicine. She graduated from the National College of Natural Medicine, and she started her own practice back in the late 90s, where she launched her own practice, which is specialized in a root care approach. And this was managing anything from what was classified as mystery illnesses through to viral syndromes through to autoimmunity. And she then is also incredibly well known for her role as director of medical education at IFM, where she was there for a decade. And I've seen her on stage holding numerous of her babies while multitasking and setting the bar incredibly high for all of us mamas. So it is an absolute honor to welcome you to the podcast, Kristi. It's just such a joy. Welcome.
Oh, it is an honor to be here. It's reflecting back, right? And I'm thinking about my oldest, who is almost 21. She did her very first seminar when she was 3 weeks old, day 21. We were on our first flight traveling together, and she right now is finishing her last year of pre-med, and she's going to be down the pathway in another year. And she's getting this dual degree, this undergrad degree in both neuroscience and psychology. So it's kind of exciting. I'm going to get to watch my literal next generation, step into healthcare and medicine. So it's pretty amazing
Isn't it so fascinating? So my daughter, I only have one, but she's also 21, and yeah, it just really just seems like just yesterday that we were there just at IFM in that inaugural AFMCP that came to London. And there we were. It just seems like yesterday. Anyway, we continue.
You say that, I'm laughing because I'm thinking my youngest, who is now 14, she never slept. We got to that inaugural event and she was in the baby Bjorn all night long. So while you were all sleeping, I was walking babies and then I was up teaching all day long. I loved that event. It is like forever burned in my consciousness, and the last baby that I had.
No,
Well,
no, there is.
let's dive into this topic.
Let's dive into it. So, Kristi, please just indulge us a little bit, because there will be some people on the podcast who are very familiar with you, and others maybe clients of those practitioners that are loyal to Amrita that don't quite know who you are and what some of those acronyms are. So it would be really great for you from you to just give us a real sort of whiz stop tour of who you are, and really sort of what brought you into this and what sparked the interest in your brain of what brought you into natural medicine, and then sort of really now where you are with these sort of this specialist interest. So yeah.
Love it. And, I've been doing a lot of deep reflecting. I'm teaching retreats. I'm teaching 4-element retreats, and I'm doing a lot of root cause care. So it has actually brought me back to my timeline and really looking at this journey. So when I graduated from the National College of Natural Medicine that is located out in Portland, Oregon, it was 1997, which is wild to be able to think it was that long ago. And, I hit the ground running. A huge piece of my training while I was in naturopathic medical school not only happened at the school and the college, but I spent a substantial amount of time, literally 2 years, working with a physician every day after school, Dr. Carolyn McMakin, who is really world famous at this point for her work in frequency specific microcurrent and resonance medicine. So I hit the ground running with pain management, knowing about the mitochondria, looking at all these amazing tools that we can bring together, both the art and the science of physical medicine, looking at some of the tools and the powerful components that we can bring in with food, diet, nutrition, and really botanicals. They're my sweet spot. I love food, nutrition, and botanicals, which really set me up for this love of nutrigenomics, to emerge. So that's like 30 years ago. It's kind of wild to think 30 years I've been seeing patients very actively and in this integrative space. So I went back to Minnesota. I chose to go back to my home state because there were only 6 naturopaths in my state at that time.
Wow.
Yeah, so I was number 7, and that was always my favorite number. So I thought, well, that's got to be a good omen, And so I went back, opened up the door, got my shingle on, and was immediately packed. Within 6 months, I had a full practice load, and I can say it's really not ever slowed down since, which is just an absolute blessing. Right. So I'm in my naturopathic medical world, and I kept hearing about this guy, Jeffrey Bland. I kept hearing this name, Jeffrey Bland. I kept hearing about these sort of original, I would say now legacy nutrition companies
Yes.
that really going back 30 years were really the only ones putting on seminars and educational events. And so I sat through my Jeff Bland experience in 1998, and I was never, ever the same person ever again. Like that was it, like that was a landmark moment for me. And I jumped on the next airplane, flew out to the first IFM symposium that I had ever been to in 98, Vancouver, Washington, if I've got my dates right. And I was like, what is this AFMCP thing that everybody's talking about? So 1999, 2000, 2004, and 2007, I went back over and over to AFMCP because it was the only program that IFM put out at that point. And
Right.
I remember, being in one of my last programs and having this chat with Lori Hoffman and talking to David Jones, who were executive director and founding president, and saying, wow, you have this new job offer on the board that showed up for an associate director of medical education, but I noticed that you're only taking in applications from MDs and DOs, right? Here, the osteopathic doctor.
Wow.
Boy, that job description is like my dream job. I'm like, gosh, too bad I'm a naturopath. And I didn't mean anything other than, wow, I saw that. What a great job description, because when you're a naturopath, you don't always have the same doors open to you.
No,
And
definitely
I
not. No, that's right.
sort of, right, walked through some of those conventional doors. And 3 days later, I get this call. We've been talking about what you said the other day, and we would love to get you in for an interview. Let's explore this option, and let's maybe talk about some of the possibility of you joining us at IFM. And that is really probably one of
Oh
my
my God, that's
second
amazing. I love
landmark
that.
days. Yeah, it was just such a like goosebumps, life turning, phenomenal opportunity. And I had already been in medical education at that point. My medical education had been for nutraceutical companies and some of the functional labs. And I loved teaching, and I loved program design. And for me, the perfect balance was in my office, boots on the ground, seeing patients at least half of the time. And then I really loved being able to go out and teach because, as you know, when you teach something, you have to learn it at such a different level of being
Totally get that. Yeah.
like all these different ways that I love this balance of teaching and seeing patients, teaching and seeing patients. So that was the beginning of work that I took at IFM. Went on to spend almost a decade there. Grew up, I would say, in medical education and my life, right? Having babies, developing my medical robust applications. And I stayed there for a really long time, absolutely loving the work that we were doing in medical education. So I got to be a part of all of the IFM toolkit formation and then bringing their certification program to light. And then I needed to be home with my kids. And so I pivoted,
Yeah.
kind of stepped back a couple years before the pandemic. Interestingly, went back into private practice and did a little bit of teaching on the side. Did a
Yeah.
few contract lectures because I love to teach. But I went back and was saturated in patient care once again. And then the pandemic hit. And fortunately, I had already pivoted to be capable of doing all Zoom and telemed medicine. And so honestly, it was like at a drop of a hat within a week. We gave up brick and mortar practice,
Yeah.
and spring of March of 2020, my whole entire practice shifted, and all of the teaching and training I did shifted over to Zoom and webinar.
Yeah.
And you all know how that story has gone, right? For these last 5 years. So I have always lived with my foot in both worlds of clinical care based on functional integrative root cause medicine, and then spending at least 25 to 75% of my time dedicated to educating both healthcare providers, nutrition professionals, what we would call often integrative or CAM providers, and patients. I love to educate the public.
I just mate, your elevator pitch is is word perfect. That's just such a beautiful background to that. I haven't ever heard you explain how the IFM role actually came about, and but you're not the first guest and you won't be the last, and myself included. There are so many of us that there was a defining moment of hearing Jeff Bland, and yes, so many of us say that, and it was because is revolutionary, and it sort of turned so many heads, and it's changed lives. I mean, it's a phenomenal part family community to be a part of, even in a tiny bit. So yeah.
You know, I had the absolute privilege, a very unique scenario about a year ago, because part of what I would love to talk about with you today is immune rejuvenation and immune resilience, right? It is a part of our conversation today. But a year
Yeah.
ago, I had the opportunity to spend a 2-day seminar co-teaching with Jeff Bland, like the old days, like 20 years ago when Jeff Bland would go teach a full day seminar. And, you know, it was just such a fascinating conversation to hear Dr. Bland 20 years later talking about leaky gut and intestinal permeability, and us co-sharing this weekend together, where the conversation really was about, we had leaky gut, which has now caught up with the microbiome conversation. You know, IFM and the whole functional medicine movement was really leading that conversation 20 years
Sure.
ago. But today that conversation expands to the gut-brain connection. It is engaging and it involves leaky vessels and leaky membranes and challenges with the blood-brain barrier, right? So here we are again. It is a 20-year window, you know, teaching and being engaged in some of these really breakthrough conversations. And really the story we had to tell today is so innovative that most healthcare providers, at least here in the United States, and many I've met abroad, but most healthcare providers never learned in medical school about the endothelial glycocalyx. They're
No.
barely competent in understanding the unique dynamics going on that's accelerating dementia and challenges with the blood-brain barrier. And they're just finally getting caught up to speed with the microbiome. And so
Yeah.
the concept, right, of immune rejuvenation is
Yeah.
a cardiovascular conversation. It's a vascular integrity conversation. It's a GI modulation conversation. It's a diabetes metabolic conversation. The immune system we now know today involves neuroimmuno
I
response,
mean,
right? It's brilliantly evolved.
so let's unpack some of that, because that does weave in beautifully to what we agreed that we wanted to cover today, in terms of, as your career has evolved, you have taken in the last, yeah, you've taken a really passionate interest in vascular health and how that is connected to the immune system and the nervous system, sort of pulling apart all of those sort of words that you were talking about. So let's start off with, you mentioned this term, an endothelial glycocalyx and vascular health, and how that connects to brain integrity and sort of blood brain and integrity, membrane integrity. So let's just sort of pull that apart a bit and understand what sort of how it why vascular health is so important, because you're right, it's so often when we hear about vascular health we immediately think of cardiovascular disease, but there is sort of, we can unravel and make this connections through to all of these other systems. So could you help us to understand that a little bit more?
This is such an intriguing conversation because I do end up talking about this every week with patients, actually every day, I would say, with patients on the weekends with healthcare providers. And it is such a new concept. And I think it is probably one of the most important understandings and discoveries that has really emerged over the last 10 to 15 years. And still, very few people know about it. Right. So at least, you know, over here in the United States, I think in miles, you're all probably thinking in kilometers, but in our
No,
sort
no,
of
no, we think in miles.
in miles too. Okay.
Yeah.
So like imagine like you have 60,000 miles of blood vessels in the body. I mean, that's just astronomically high
Yeah.
volume, right, of tissue response. And so when we think about the inside lining of the blood vessels, we're talking all the way through the arterial system, down into our little arterioles, down into our capillary beds. The lining inside of the vasculature is made up of this thin, one cell thick layer that is known as the endothelial tissue.
Mm-hmm.
One delicate, thin layer of endothelial cells, interestingly, serves as this barrier between everything that's moving through the lumen, or say the tube of the inside of the vessel, and the basement membrane, which is made up of muscle, muscular contractility. And this is the interface. This is the hot spot where plaque evolves. And so, underneath this basement membrane, we find that this is where scientific discovery has really opened up in the last 10 to 15 to 20 years to say, you know what? Cholesterol is not the cause of plaque or atherogenic dyslipidemia challenges. Cholesterol is not the cause of heart
Yeah.
disease. It's a part of the storyline, it's an ingredient in a formula, right? So, what we now know is that now on top of that lining inside of the blood vessel, so even think about it like plumbing or even like a PVC pipe, like imagine this one cell thick coating inside of that piping, right? And then on top of that, inside the lumen, it's almost like these little hairs, these little fibers, almost like a little seaweed in there. It's like a Teflon coating. It's like this incredibly slippery coating made up of these protein glycans. So I'll try to keep it at the level that sort of all of our average listeners can really understand and grok.
Yep.
We
You're doing a great
have this
job.
beautiful list, like incredible activity that's happening, like almost like a little carpet that's hanging out inside of those vessels. Like I don't recommend Teflon pans, but it is like Teflon. You know, it's what makes the inside of the blood vessels slippery. It's
Yep.
what allows for the blood cells to go flying through our red blood cells for movement, for flow dynamic, and it allows for this possible exchange of information to be happening down in that little carpet, in a sense. And there's so much going on down there. We have these things called adhesion molecules. Inside
Mm-hmm.
of that basement, inside of that membrane, we are releasing things, so these little biochemical markers, these chemokines. They're communicators that when there's damage or trauma or insult, they could be coming from things like smoking or sedentary behavior or high blood sugar levels or unhealthy food choices, stress compounds. I mean, kind of the list goes on and on. They're the things we think about related to heart disease, right? When these little compounds are signaling to that basement membrane that there are issues and trauma underway, we release these little compounds, VCAM and ICAM, and they yell up into the system and say, we've got damage, we have trauma. And they attract, they woo, they like pull in these white blood cells, which then attach. They move through that one cell thick layer, and we now get this deposition of what is called monocytes. And these monocytes, which are a kind of our white blood cells, they're a tissue response to inflammation, damage, and insult. So the
Yep.
body's doing what it's supposed to do, right? It says, look, we got a problem down here. We need help at the level of the vasculature. Get us some assistance. So in come the immune cells, and in the presence of inflammation, and in the presence of what's called oxidative stress, this equation leads to these little white blood cells chomping on oxidized LDL and converting into foam cells. And foam cells are the building blocks for plaque. Now, all
Yep.
of a sudden, we end up with these different subtypes of plaque. We've got harder plaques, calcified plaques, we have soft plaques. And we definitely are in an era right now where healthcare providers, especially integrative cardiologists or your integrative functional medicine providers, who are using these brilliant tools in their assessment to look more carefully at hard and soft plaque, to look more carefully at subtypes of lipid based molecules, to look at inflammation, to be looking at these compensatory and collaborating factors, because this amazing engagement that's happening on the inside lining of our vessels, this is where heart disease begins. And so we are seeing this incredible application of this new discovery of the endothelial glycocalyx again, this sort of Teflon coating that's there inside of the blood vessels and the little capillaries. It's so important because like this is where platelet stickiness happens. This is where leukocyte adhesion happens. This is where we have this important dance, this recycling of antioxidants that are trying to quench reactive oxygen species. Right here is where we have anti-inflammatory mechanisms of action that are taking place. So plaque, cardiovascular disease, hypertension, right?
Yep. Yep.
This is just the foundation, and we at least know over here statistically in the United States, 70% of people who present in an acute MI situation, that's their first presentation. That is their first symptom. And when you look at those statistics, it's only around 50% of them that have altered lipids.
Yeah. It's exactly the same here, and it's and also they're very sort of we're not routinely measuring all of these other mediators and markers, more we can call them more advanced markers that are sending signals and alerting us as a physician, an informed physician, that there is this sort of imbalance between inflammatory processes and reactive oxygen species and our endogenous ability to be able to mitigate that. So if you're just looking at a standard blood chemistry, these signals are not really we don't have the capacity to see these signals, right? I'm sure this is the problem. So the endothelial glycocalyx, as you've beautifully, is like a shag carpet, Teflon. It's sort of very much part of our built-in protection mechanism. It also produces, in part, this very important compound called nitric oxide, which plays a part. Could you explain what that is and what that link is for us, please?
Oh, it's such a huge breakthrough discovery, right? Because
Yeah.
it is within this particular location inside of the vasculature where nitric oxide manufacturing and recycling takes place. Right.
Mm-hmm.
So, kind of over the years, there's been a lot of conversation around nitric oxide, especially in some of the areas where athletic performance was involved. It obviously hit sort of mainstream conversation, often around hypertension regulation, sexual function, sexual performance, and obviously the wave of medications that were designed to help with sexual performance as it related to nitric oxide performance in specific areas of the brain, specific areas of the body, right? We had very unique, interesting applications. And so hence some of these medications have even been found to work with blood-brain barrier support and focus and concentration, where they were originally used for erectile dysfunction. And now we are interestingly seeing sort of the application of some of these drugs, right, being used in men and women both with a little bit of a different, wider reach. So that's kind of its own discussion. But nitric oxide, interestingly, we did also grow through an era where, everybody said, oh, well, if you just take supplementation with arginine, that's great. Or maybe you just need to drink a bunch of beet juice and eat a lot of beets, and that will work, right? And what we've learned about nitric oxide and this recycling system that's happening again at this level of the endothelial tissue, the presence of the endothelial glycocalyx makes it possible for adequate levels of nitric oxide recycling, enough
Okay.
activity levels. And so there's really like three big things that happen there. The endothelial glycocalyx helps to trigger the production of enos. And
Yeah.
enos will help to make nitric oxide, which is active for sort of a short acting window of time. It's discharged, its activity level as this important scavenger is present, and then it goes through this recycling degradation process. Right. So like what athletes have been looking for, what so many in brain performance and cardiovascular health have been looking for is like, is there a way that we can extend the duration of availability so that nitric oxide can hang around for a while, do these great things that connect back to vasodilation, relaxing the musculature, right? Some of the most important things come back to what are our underlying problems and challenges that are facing us with cardiovascular diseases today, right? So if we want to think about a dysfunctional shag carpet Teflon, right? If we
Yeah.
don't have an adequate coating of this very fragile lining of the vasculature, which is again called the endothelial glycocalyx. I want to keep saying it because it's a new,
No, do.
right? So repeat it after me, endothelial glycocalyx. It's kind of a
Got it.
mouthful, right? And so when there is less functioning or damage to the endothelial glycocalyx, there is less nitric oxide endosynthesis. That's internal production that's taking place within the vasculature. There's less enos. There's less bioavailability of these healthy reactive oxygen species. There's less SOD, super oxide dismutase, which many of the nutritionists and the physicians, have certainly been sort of keeping a pulse on over the years, because SOD is touted as being one of the most important antioxidants that is certainly linked back to vitality, and some even draw it into the anti-aging conversation. Right? So dysfunction at the endothelial glycocalyx leads to endothelial dysfunction, which creates the environment that allows for plaque formation, which leads downstream to not only heart disease risks, but it leads to hypertension, sexual dysfunction, dementia, or challenges potentially when the involvement is happening up at the level of the blood-brain barrier. Right? We see fatigue disorders that are present. We see athleticism and athletic challenges that are present. So this interesting and important connection back to nitric oxide really is that it's sort of a three-way goal therapeutically that we're looking to accomplish. One, what can we do to heal the lining of the blood vessels,
Yeah.
regenerate, right? Regenerative health for the endothelial glycocalyx.
Yeah.
Right? Why do we want to do that? Because that's what triggers enos.
Yeah.
That's going to help us with our endogenous production of nitric oxide. Two, what are some of the tools in our toolbox? Can we use food and nutrients? Can we use ingredients, that are compounded and organized to help rebuild the lining of that Teflon? Can we use nutrients to extend that ongoing duration of how long that nitric oxide can hang out in that particular brush border inside of the vasculature? And then are there tools in our toolbox? Can we use natural ingredients and natural agents that allow for us to prevent the actual degradation or the breakdown, right, on the other side of nitric oxide? And that comes back to a whole very intricate dance. Many of the physicians who listen to your podcast would be familiar with this whole process of how GTP impacts cyclic GMP, which accelerates the degradation process. And hence, what we're looking for is how do we slow down this whole phosphodiesterase 5 enzyme so that we
Yeah.
allow for the preservation and sort of the maintenance of nitric oxide hanging around as long as we can, because our goal is going to be muscle relaxation, vasodilation, gentle muscle relaxation, right? And perfusion of oxygenated blood supply into the areas, right? And this obviously carries over to a whole conversation that involves blood sugar dynamic, insulin resistance, and what in a trajectory manner could end up leading to the formation of type 2 diabetes.
Yeah. And then we can keep going. So in terms of how this would impact the brain, because and the vasculature and the nutrients and the perfusion that feeds the brain. So this is just the beginning of an incredible conversation, which you've of course explained beautifully. And I think what came into my head also as part of that was you mentioned this enzyme superoxide dismutase, which there's been a lot of conversation of this enzyme by the work of Lisa Mosconi and Roberta Brinton, with their conversation around because they're neuroscientists, and that it's embedded within the mitochondria and specifically within the brain, and as a cofactor, it is estrogen dependent. So there was an aha moment for me with when you said that, in terms of sort of it's superoxide dismutase is involved, which of course in this milieu and this conversation it's another impact, isn't it, in terms of when women go through the life stage and end and graduate to menopause, that enzyme is now missing one of its important cofactors to be able to ensure the integrity of the mitochondria to produce ATP as effectively as it could do. So it's such a connected conversation that we've touched on.
And we look at like how unique women are in that mature third era of life, like that we've seen for how many decades now. Women needing different levels of intervention, nutrient level support, lifestyle modulation to be happening in that era of life when hormone decline is natural and normal, not
Yeah,
necessarily always what we want to maintain. I mean, there's a whole conversation around healthy and ideal bioidentical hormone replacement therapy,
yeah,
right? Which is without a doubt finding kind of center stage. But I think it is so interesting that this has set up so many women for challenges in their cardiovascular markers, their
yes,
dyslipidemias, and the elevated risk of stroke and heart disease, right? Acute MIs for
yeah,
women. We look at the exchange or interface that's happening with their hormone levels, and
yeah,
frankly, to throw sort of a zinger in the mix, and all of this has
yeah, yeah,
accelerated, right? All of this, all of our most susceptibles has accelerated from pediatrics, adolescents, all the way through those who are in those senescent years. We have seen that the onset of exposure to spike protein, engagement with the ACE2 receptor site, triggering damage to the endothelial glycocalyx, in this post-pandemic era, right? We have seen just exposure to this SARS-CoV-2 infection or potentially introduction of a vaccine either are causing cardiovascular, contributing to vascular complications. And we have this whole entire story that many of us practitioners now really understand, this post-COVID syndrome, this long hauling complication that many are seeing across all ages, right? We already have
yep,
mortality stories that we could tell from the last 5 years, but we're in an era now where we have the walking wounded, right? Where we have healthy, athletic individuals who are mindful, eat great, move great, sleep great, have been very dedicated to their lifestyle program and are
yep.
exposed to spike protein. And the impact of where they are often being hit is at their endothelial glycocalyx.
Which is absolutely. And there, I'm going to, at the end of this podcast, so hang on, I'm going to, I'm sure you're all on the edge of your seat. I'm going to highlight some times where Kristi is over in Europe, and she's going to be in London, so you can come and chat to her more about that. Um, but before we bring this to a close, let's then circle back to a very important component to this of what have what are the nutrients that we know that we can use in our toolbox that can help to support the integrity of the endothelial glycocalyx and the production of nitric oxide.
Well, I think the superstar that has really shown up, we are actually seeing that there is this very unique form of a seaweed. And that seaweed, Monostromum nitidum, this incredible seaweed, they tested multiple different types of seaweed, and they looked at the impact that it would have on the inside lining of that endothelial glycocalyx. And again, back down to that sort of shag carpet. And it was identified that there are resources, combination of nutrients that are natural that can engage with this rhamnin sulfate formulation. So rhamnin sulfate is the name of the phytonutrient that is found inside of the seaweed called Monostromum nitidum, right? So we think about, you got carrots to get beta carotene, right? And you have tomatoes and you get lycopene. Like we go on and on with 5,000 different foods and their extracts, right? We've got this seaweed called Monostromum nitidum, and inside of it is this rhamnin sulfate, right? And this unique formulation allows for a more rapid and quick rebuilding and actually regenerating of the endothelial glycocalyx. So I think
Amazing.
begin right as we start right there, because if we can change that little Teflon and we can very quickly offset some of those challenges that emerge and are a big piece of the story when it comes to accelerating brain fog, fatigue syndromes, cardiovascular disease, I mean, hypertension, we go down this whole list. Start there. That is one of the most important places for blood sugar regulation, for our ability to control vascular response. So do we talk about names of things, or do we
No,
just
no. Well, I was going to go on to say that this particular algae, this blue algae is patented and through Calroy Health Sciences, isn't it? And this is the big kahuna. This is the patented form that everybody is after,
got
really.
it? Well, this is what I do in my practice. And from literally the minute these two formulas, there's two of them that I would describe for you. And now that gives me sort of the permission to talk about what do I do every day? What do I take every day? And what do my patients use on an ongoing
Yeah,
basis? So honestly, what changed my life as a long hauler was the application of bringing in a formula called Arterosil. And Arterosil, the superstar, like when I'm looking at botanical formulas, there's almost always a champion ingredient, right?
yeah,
There's always a hero that's in there, right? And then there are cofactors, other ingredients brought to surround it, right? And so in the Arterosil formula, this is where we heal and support the regenerative nature of the endothelial glycocalyx. Right. So honestly, there's hardly anyone in my practice now. If you walk in the door and you are telling me you have fatigue, exhaustion, brain fog, you're struggling with exercise, you have like shifts that have happened post pandemic, or you have a cardiovascular disease history, or labs that are concerning, or a family history of cardiovascular disease.
yeah,
Those are going to be some of the biggies for me. And you are in my practice going to be taught and trained on the endothelial glycocalyx and why we're going to use rhamnol sulfate as one of our most important formulations. So what I do dosing wise with Arterosil in my practice, and what I did as a research case treating my own long haul, where you begin most patients is you would start often at 2 and 2 of your Arterosil. I usually dose breakfast and supper for my patients. We
yeah,
hold those levels for about a month because I'm looking to try to get this load on and try to hit that Teflon, that seaweed regeneration, right?
yeah,
And then we step down the goal, then, especially in the long haulers where you're treating them for about 12 to 16 weeks. Then I step down to 1 and 1, hold that dosing schedule while we're rehabilitating the mitochondria, working on other cofactors, working on the vascular integrity. And then when someone hits the goal levels, I like to drop them down to just 1 a day for maintenance. So, depending on the history and how acute the cardiovascular challenges, or whether we have reports of soft plaque or calcified plaque levels, that would inform whether I'm going to maintain a patient on either 1 or 2 Arterosil every day. Then the second companion, I would say, to that hero formulation is a formula called Vascanox. Okay.
yeah,
And Vascanox, just to sort of simplify it, when you look at that label, it is a combination of nutrients and ingredients that are not only designed to help optimize the production of nitric oxide, but that formula works on supporting something that is called hydrogen sulfide. And that piece of the whole enos recycling story, that plays such an important role when we were talking about extending the duration of nitric oxide's activity and the engagement and slowing down its degradation. And so, if you want to look at that full list or the ingredients that are present, there are definitely extracts and isolates that have been found to be able to orchestrate and work more effectively on a sustainable production and bioavailability of nitric oxide. And that is really what makes Vascanox stand out in the field. There's obviously been products going on now for more than 10 years, especially in the athletic market, to try to get that NO burst and give people kind of that bump. And we do see that products can give on average a couple hour burst. What's very unique about the way that this formulation has come together, called Vascanox again, is it is allowing for all three components of that cycle: production, extended duration, and reduced slowing down or compromisation of the degradation and recycling process. We want nitric oxide to show up, hang around for a long time, do all the great, wonderful things that it possibly can do. And when you look at that ingredient list, you might say, like, wow, where is that one thing in there? There's not the one thing. That's what we've learned about vascular recovery. We've learned that it is actually a combination of sustaining and supporting that hydrogen sulfide presence that allows for us to move into a 24-hour sustainability of the production, the natural body's production of nitric oxide, because it's the endothelial glycocalyx that has to turn on that process and allow for the sustainability to take place. So the goal, if you're going to try to hit hypertension and you're going to really work with muscular relaxation slash vasodilation, it's a 1-2 punch, right? It's
Yep.
1-2. You're going to want to look at integrating them both. The thing that's great about Calroy's line is that they have provided some unique salivary testing strips that allow
Yep.
you to isolate and identify some of the differences between nitric oxide levels and how we can see food and dietary influence, which is a little bit different than what we have going down at the level of the endothelial glycocalyx, right? Because diet can influence things. So those salivary strips are wonderful because it helps you get sort of that sense of what's going on in the oral microbiome, what could be going on at more of a systemic level, and then the patients can test their before and after levels, and they can see that they're utilizing the right dosing. Do they need 1 a day or 2 a day of that Vascanox? And they usually only take it once a day. It's 1 or 2 at the same time to be able to get that full 24-hour sustainability of nitric oxide bioavailability.
Amazing, amazing. And there is a whole branch off, or many branch off conversations from this. But there are you've used the term Romana, excuse my pronunciation, but sulfate. And of course, sulfate is a vital component to all of our endothelial tissue, right? And you've also used hydrogen sulfide, which we are coming out of an era of practitioners being in sort of going down a rabbit hole of removing that hydrogen sulfide is the devil, and so I'd really and removing that, and I can't let you go without asking that question
Oh,
because
it's an awesome question. I think that's what really makes this combination of nutrients so powerful, because where we struggle as clinicians with patients who have the wrong levels of producing hydrogen sulfide is in our SIBO cases.
yeah,
Right? It's in the microbiome. So this is a very tissue specific discussion, right? And so we do not see, we're not giving anyone hydrogen sulfide that's going down into the gut that would proliferate a SIBO case, right? We are
yeah, yeah,
not driving, no one would recommend doing that. It's in the microbiome, you've got altered bacteria that are present that can increase the production in the gut microbiome, which
yeah.
leads to challenges with, of course, digestibility, gas bloating, and we could go down that piece. This is a very different conversation. We're talking about the formulation supporting at the level of the vasculature and in and within the basement membrane and the endothelial glycocalyx. We're talking about a natural required production that will come from utilizing key food ingredients that will support the body's production at the right place. The body is brilliant,
Isn't
right? The
it
body is brilliantly genius in its sense of knowing how to take cofactors and produce what it needs in all the right places.
incredible? Kristi, I could talk to you for hours. I could talk to you for hours, and I'm sure our listeners could listen to you for many more. So, a brief summary of where you can hear, watch, and even meet this wonderful woman. She is coming over she's going to be in Dubai first. She's going to be in Dubai in May. Then she's coming to London to 17th of May to be delivering a conference on metabolics and women's health. And then she will be all over IPM delivering, which is in June. And she will be there for the full 3 days. And she will be also visiting, and she will take residency on the Amrita Nutrition stand. So I will keep you all posted when we have arranged for her to do that. So you can come and ask her questions. And she's so, as you've heard, so incredibly generous with her time and with her information. So, Kristi, I can't thank you enough. You've just been an absolute joy. And I can't wait to get you back across the pond. And I'm so thrilled that you're spending so much time here across our summer. And I look forward to hosting you in June.
Thank you for having me. I really appreciate the conversation. And you know, the more we all talk about these factors and share this information with those we love, I just think it's absolutely remarkable to see all the connections that happen for individuals so they can take charge of their health and their recovery process. So thank you so much.
You're welcome.